Hi everybody, today I am going to talk about how to identify the early stages of frozen shoulder, that means the freezing stage of frozen shoulder. Frozen shoulder is a condition which is characterized by abnormal tightness and contracture of the joint capsule of the shoulder joint, which gives pain and movement restriction. Especially these people will be suffering night pain. They will be also having abrupt jerk pain while doing the normal day-to-day activities. It is one of the most difficult and challenging condition both in terms of medical as well as physiotherapy perspective. I do get patients with frozen shoulder, but most of these patients they visit me during the frozen stage of frozen stage, that is the second stage, and this stage they will be experiencing severe pain. And in this stage, the joint would have got already contractured and they will be having extreme pain and movement restrictions. I only wish that if these patients were identified during their freezing stage of frozen shoulder, they probably wouldn't have gone worse during the frozen stage of frozen shoulder, because if they are identified early, we can quickly intervene in a way that the joint cannot go for that full-blown stiffness stage, and it also can significantly reduce the pain, the time and the effort and the money towards the treatment of the frozen shoulder. The intent of this particular talk is to make the patients as well as the professionals to identify the early stages of frozen shoulder. What are the clues that we need to identify so that we know that it is a frozen shoulder? Why diagnosing this early is important? Almost 90% of these patients, when they are in the freezing stage, they will not realize that it is a frozen shoulder. Even if they happen to meet a medical doctor, the clues that it will give will be very deceiving in nature, that very less medical professionals will be able to identify it as a frozen shoulder. And that's the reason why 90% of these patients during freezing stage, even if they meet a medical doctor, they will not get a proper diagnosis. Rather, they get a diagnosis like tendinitis or muscle pain or muscle catch or early arthritis and so on. But it is imperative that these patients were exactly identified early, because the cost of ignoring during the freezing stage and misdiagnosis of this condition will cause next 1 to 2 years of pain and disability. And you all know that sometimes these patients even need surgery to get the movement back. If these patients were identified correctly during the freezing stage and give a proper physical therapy intervention, then majority of these patients will hardly go to the frozen stage, or even if they go to the frozen stage, the pain and the disability will be significantly less, that they quickly get into the thawing stage and then the entire pathology will get over super fast than dragging it for next 1 to 2 years time. Here are my simple self-help methods by which every patient can identify that they are getting into the freezing stage of frozen shoulder. The first thing is pain at night. These patients they will be slowly starting to get pain at night, especially when they change positions from one side to other side. But eventually the night pain will keep repeating every day. If they are getting night pain consistently for 3 to 4 days at a stretch, or at least in a week about 3 to 4 times if they get night pain, then that's the first warning. The second warning is loss of the range of motion, that to the reserve range. We all know that the shoulder joint can move 180 degree from 0 degree. Shoulder joint can move from 180 to 0 degree. Now we do have something called reserve range. That means even after 180 degree, we'll be able to move another 10 degrees like this. See, from 180 we can go another 10 degree. From 180 we can go another 10 degree. Another 10 degree. So this we call it as a reserve range. When the frozen shoulder strikes the shoulder, first it will restrict the reserve range, and then it will truly restrict the anatomical range. So these patients, when you ask them to move, one shoulder it will go like this, the other shoulder it will be difficult to move. So that means what? They are slowly losing the reserve range, and which will be one of the characteristics of early frozen shoulder, which won't be very apparent during the normal testing. You ask them to move, they move normally, but if you really test like this, then you will be able to identify the hidden restriction of that reserve range. So with that, you will be able to identify that the shoulder is slowly starting to freeze. And do check how much the sound side is moving. Same way the affected side should also move. If both are moving equally together towards the end reserve range, both in flexion as well as in abduction, then you will be able to identify whether the reserve range is affected or not. The third clue is that when you make the patient to sleep on their tummy and ask them to touch their back, you need to ask the patient to do one shoulder after the other shoulder and check for the movement flexibility. If the range is restricted to at least 10 degree or more, then that qualifies that they have restricted shoulder range of motion, especially the internal rotation, because in frozen shoulder the rotatory movement will be affected first, then the sagittal or the frontal plane movement, which is forward movement or the side movement. So the restriction of the rotational movement is one of the good hints that it is going to get the frozen shoulder. Why you have to ask the patient to sleep on their tummy? Because when they sleep on the tummy, there can't be any compensatory movement happening in the trunk or in the scapula, so that whatever movement that happens in the shoulder, it's purely coming from the glenohumeral joint, the true ball and socket joint. In that position, if there is a restriction, then that indicates that there is a true shoulder joint restriction or the glenohumeral restriction, which indicates that the capsule is tight in the shoulder joint. The fourth clue is by asking the patient to elevate the arm on the bed itself, and then you ask them to roll front to back with their arm kept over the sides of the head. With that, they complete the rotation once or twice, and if the patient is comfortably able to do without any significant pain, and you compare with the other side rolling, if the quality of the movement is same and if there is no pain whatsoever, then you can say that there is no frozen shoulder. But if there is any restriction or if there is a pain during rolling compared to the other side, then that also is one more hint that the shoulder is slowly freezing. Now, I have given 4 hints. In these 4 hints, even if 2 hints are positive, then you can positively say that the patient is having a frozen shoulder. This is especially true if these patients are beyond 40 years with a family history of frozen shoulder or a cardiac problem or a thyroid or diabetes, then the chances of they having frozen shoulder is quite high, and you need to quickly refer them to a physical therapy program. So you will minimize the chance of becoming too tight or too painful in the next stage of the frozen shoulder. So meet a proper physiotherapist who are trained in frozen shoulder management, who will give you that end range movements. In that way, the capsule in the end range will get stretched more, thereby the capsule will never go into the inflammatory contracture phase. So with this method, you will be able to diagnose early, treat it early, so that the prevention of future pain and disability is drastically reduced. I trust you like our videos, so please keep watching us. Thank you so much.